Welcome to our Art Integrated Project, Biology. Our topic for Art Integrated Project is Reproductive Health. According to World Health Organization, reproductive health means a total well-being in all aspects of reproduction, that is physical, emotional, behavioral and social. India was amongst the first countries in the world to initiate action plans and programs at national level to attain total reproductive health as a social goal called family planning. Initiated in 1951, improved programs covering wider reproduction related areas are currently in operation under the popular name RCH program, creating awareness among people about various reproductive related aspects and providing facilities and support for building a reproductively healthy society are the major tasks under the programs. Right information to the youngs so as to discourage the children from believing in myths and have misconception about sex related aspects. Proper information about reproductive organs, adolescence and related changes, safe and hygienic sexual practices, STDs, AIDS, etc. With the help of audiovisual and print media, governmental and non-governmental agencies have taken various steps to create awareness. Introduction to sex education in school should also be encouraged to avoid sex-related crimes. Reproductive health requires strong infrastructural facilities, professional expertise, and material support. These are essential to provide medical assistance and care to people in reproduction related problems like pregnancy, delivery, STDs, abortion, contraception, menstrual problem, infertility, etc. Statutory ban on amniocentesis, a fetal sex determination test based on the chromosomal pattern in the amniotic fluid surrounding the developing embryo. For sex determination to legally check increasing female feticides, massive child immunization, etc., are some programs that merit mention in this connection. Saheli, a new oral contraceptive for the female, was developed by scientists at Central Drug Research Institute CDRI in Lucknow. The world population, which was around 2 billion in 1900, rocketed to about 6 billion by 2000 and 7.2 billion in 2011. Our population, which was approximately 350 million at the time of our independence, reached close to the billion mark by 2000 and crossed 1 billion in May 2000 to 1.2 billion in 2011. Now coming to some measures to control this. The most important step to overcome this problem is to motivate smaller families by using various contraceptives methods. A happy couple with 2 children with the slogan Hum do, Hamare do, we two, our two, and World Child Norm. Many couples, mostly the young urban working ones, have even adopted and one child norm. Statutory raising of marriageable age of the female to 18 years and that of males to 21 years and incentives given to the couples with small families are two of the other measures. Now coming to the prevention, that is contraceptives. An ideal contraceptive should be user-friendly, easily available, effective and reversible with no or least side effects. No way should interfere with the sexual drive, desire or the sexual act of the user. A wide range of contraceptive methods are presently available. Natural or traditional method, barrier method, IUDs, oral contraceptive, injectables, implants and surgical methods. First coming to the natural methods, work on the principle of avoiding chances of ovum and sperm meeting. Periodic abstinence is one of such methods in which the couples avoid or abstain from coitus from day 10 to 17 of the menstrual cycle when ovulation could be expected. Withdrawal or coitus interruptus is another method in which the male partner withdraws his penis from the vagina just before the ejaculation so as to avoid insemination, lactational amenorrhea, absence of menstruation. Next is the barrier methods. Condoms, most common and effective barrier method when used properly. Latex should only be used in the prevention of pregnancy and spread of STDs including HIV. Typical effective rate is 88%. Combining condoms with spermatides raises the effectiveness level to 99%. Next is the femidums, made as an alternative to male condoms. Physically inserted in the vagina, typical rate is 79%. Next is the diaphragms. Typical effectiveness rate is equal to 80%. Latex barrier placed inside the vagina during intercourse. Spermidine jelly before the insertion, inserted up to 18 hours before the intercourse and can be left it for a total of 24 hours. Next come to the volts. 95 to 99% effective, a new ring is inserted into the vagina every month. Doesn't require a fitting by a healthcare provider, does not require spermicide, can make periods more regular and less painful. Next is the cervical caps. Latex barrier inserted in the vagina before intercourse. Caps around cervix with suction must be left in place 6 hours after sexual intercourse. Another one we are having spermicides, that is the chemicals kills the sperm in the vagina. Different forms are jelly and foam. Some work instantly, other require pre-insertion. Only 76 effective, should be used in combination with another method, that is condom. Another effective and popular method is the use of intrauterine devices. These devices are inserted by the doctors or expert nurses in the uterus through vagina. These intrauterine devices are presently available as the non-medicated IUDs, example sleep loop, copper-releasing IUDs, CUT, CU7, multiload 375, and hormone-releasing IUDs, Progestasert, LNG20. IUDs increases phagocytosis of sperms within the uterus, and the copper ions releasing suppress the sperm motility and the fertilizing capacity of the sperms. The hormone releasing IUDs in addition to make the uterus unsuitable for implantation and the cervix hostile to the sperms. IUDs are ideal contraceptives for the females who want to delay pregnancy and or space the children. It is one of the most widely accepted methods of contraception in India. Oral administration of small doses of either progestogens or progestogen-estrogen combination is another contraceptive method used by the females. They are used in the form of tablets and hence are popularly called the pills. Pills have to be taken daily for a period of 21 days, starting preferably within the first 5 days of menstrual cycle after a gap of 7 days during which menstruation occurs. It has to be repeated in the same pattern till the female desires to prevent conception. They inhibit ovulation and implantation as well as the quality of cervical mucus to prevent retard the entry of sperms. Pills are very effective with lesser side effects and are well accepted by females. Surgical methods, also called sterilization, are generally advised for the male-female partner as a terminal method to prevent any more pregnancies. Surgical intervention blocks gamete transport and thereby prevent conception. Sterilization procedure in the male is called vasectomy and that in female as tubectomy. In vasectomy, a small part of the vas deferens is removed or tied up through a small incision on the scrotum, whereas in tubectomy, a small part of the fallopian tube is removed or tied up through a small incision in the abdominal through the vagina. These techniques are highly effective, but their reversibility is very poor. Some of the ill effects of the contraception can be nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer. Though not very significant, should not be totally ignored. Intentional or voluntary termination of pregnancy before full term is called as medical termination of pregnancy (MTP) or induced abortion. Government of India legalized MTP in 1971 with some strict condition to avoid its misuse. Pregnancy may be terminated on certain considered grounds within the first 12 weeks of pregnancy on the opinion of one registered medical practitioner. If the pregnancy has lasted more than 12 weeks but fewer than 24 weeks, two registered medical practitioners must of the opinion. Sexually transmitted diseases or STDs. Infections or diseases which are transmitted through sexual intercourse are collectively called sexually transmitted infections or venereal diseases or reproductive tract infections. Gonorrhea, HIV/AIDS, syphilis, genital herpes, genital rats, hepatitis B, etc. are one of course the most discussed infections. Now coming to infertility, the main reasons of infertility are many physical, congestional diseases, drugs, immunological or even psychological. A large number of couples all over the world, including India, are infertile, that is, they are unable to produce children in spite of unprotected sexual cohabitations. However, the couples could be assisted to have children through certain special techniques commonly known as assisted reproductive technologies (ART). In vitro fertilization, IVF fertilization outside the body, is almost similar condition as that in that body, followed by embryo transfer in one such methods, if this method popularly known as test tube baby program. The zygote or early embryos with up to 8 blastomers could be transferred into the fallopian tube, the ZIFT, zygote intra-fallopian transport, and the embryos with more than 8 blastomers into the uterus. Transfer of an ovum collected from a donor into the fallopian tube, GIFT, gamete intrafallopian transfer of another female who cannot produce one but can provide suitable environment for fertilization and further development, is another method attempted. ICSI, intracytoplasmic sperm injection, is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Artificial insemination, AI. In this technique, the semen collected either from the husband or a healthy donor is artificially introduced either into the vagina or into the uterus, IUI, intrauterine insemination of the female. Though options are many, all these techniques require extremely high precision handling by specialization professionals and expensive instrumentation. Therefore, these facilities are presently available only in very few centers in the country. Obviously, their benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods. Since the ultimate aim of all these procedures is to have children in India, we have so many orphaned and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption and it is as yet one of the best methods for couple looking for parenthood. That's all. Thank you.